Good, how are you?
Good. Nice to see you.
Good to see you.
How are those knees doing?
Those knees are doing awesome. Yes.
I initially met Brenda when she had come to us for a second opinion about her knee arthritis. She had both knees that were giving her trouble, and she was ready for knee replacement because the pain was to the point where she couldn't do the things that she needed to do.
At a certain point, the pain was so bad I couldn't even enjoy shopping with my daughter. My next steps were to eliminate things that caused me the pain. So, riding my bike, walking, cooking. Just slowly I got out of everything that I love to do. So Dr. Stanfield did tell me I was a good candidate for knee surgery and that they have a new procedure and that he would like to try that if I was willing. And I told him yes, I would be more than willing to try his Mako procedure.
We discussed one at a time versus both at the same time and went through the risks and benefits of that, and she had chosen to do bilateral knee replacements where we do them both at the same time.
The recovery was amazing. Well, actually, the night of the surgery, the therapist came in. She took off my braces that night, and she's like, "And you're doing amazing."
She was a very motivated patient. She worked at a therapy rehab center, so she knew what she was getting herself into, and she's done wonderful with her rehab, and she's very happy with the result.
Yes, I am back to doing everything that I could do before. I am riding my bike, I'm riding my treadmill, walking with my great-grandbaby, cooking, shopping, you name it, I can do it. I can never repay him for what he did.